Low-income communities, which are disproportionately racial and ethnic minority groups, have the most problems with accessing healthcare. And so without that yearly doctor visit or that preventative maintenance, you're not getting screenings that can really prevent you from these major health outcomes. On top of health insurance or lacking health insurance and access to health coverage, they also have these things called social determinants of health, or what we in the healthcare world are now calling non-medical drivers of health. Barriers to housing, transportation, healthy water or clean air, access to nutritious food, or even the ability or the opportunities to do physical activities. These social determinants of health or non-medical drivers of health are really affecting these low-income communities and giving them those additional constraints in accessing healthcare.
St. Luke's Health is part of CommonSpirit Health, one of the largest providers of not-for-profit faith-based medicine in the United States. We're proud of our Catholic heritage, and we're looking forward to building on that Catholic identity as we move into the future. But part of that Catholic identity is seeing healthcare as a ministry. It's a service to the community. It's our ability to serve everyone across our communities.
Hospitals and local communities can work together in a multitude of ways. Collaboration is extremely important. A big part of that is listening to key stakeholders out in our community, getting their feedback, getting their insight, getting their input, so we're all working on priorities that need to be addressed and not addressing it in a vacuum. The Community Health Improvement Grants Program is a hospital-funded grants program that services local areas. It invites other nonprofit organizations to apply for funds that are working towards the significant priorities that were identified in our latest Community Health Needs Assessment. So it's a way for us to assist other organizations that are working towards the same goals in our community to reach those vulnerable populations. So in 2024, it was our inaugural year for the Community Health Improvement Grants Program. We received a very exciting 60 grant applications, and we funded 13 organizations for 19 projects. 50% of them were for access to care. Service organizations that apply for grants have to be serving those same populations that we serve. They have to be identified as vulnerable populations and working on those significant health needs. In the Houston area, we have cutting-edge technology. We have amazing innovations, but not everyone has access to them. We want to fund grant programs, local programs that are scalable, that can create lasting change in our communities.
That's super exciting to think about a world where everyone has access to healthcare in the way that they need it. I used to think about healthcare as going to the doctors and going to the doctors on a yearly basis, but healthcare is not just that anymore.
Being an academic medical center, part of that is research, and that's something we take incredibly seriously, and our partnership with Baylor College of Medicine has really helped us advance that significantly.
The great advantage of being associated with an academic medical center is you have this translational science that really drives cutting-edge medicine.
Our mission is, of course, to advance health education research, but now we have a larger responsibility of building out a life science ecosystem so that we can not only treat patients, but actually discover and advance the next generation of therapies.
What really drives innovation is scientists taking their discoveries and bringing them to the patient, and understanding from the patients what needs to be studied so you can do it in the lab.
We've now created a campus where industry, side by side with our academic institutions, can come together to truly advance those technologies to commercialization to benefit humans.
Because we have so much research going on here, and because we already have so many talented people doing that research and doing the teaching and providing care, it's become an increasingly attractive place for life sciences firms to locate. And so TMC3 Helix Park is a great example of that. Having that space available so close to the medical center, as well as the other developments that are happening around town, is going to create a real opportunity for us to get on the map in life sciences.
And so as we see some of our brightest scientists and clinicians and physicians practice side by side, we now have a new forum to allow those practices to intersect with industry in a way that allows Houston to become the leader in the life science industry.
One of the things that people may not know about organizations that are a part of the Texas Medical Center is how we really do all strive towards a mission of continuing care, research, and teaching, and really strive to push the boundaries for creating best-in-class care for the whole world.
I don't think a lot of Houstonians realize how awesome the TMC is and what's going on here. We've got major players with several different hospitals, several different medical schools. You got Rice. There's just so much innovation going on, and now with TMC3 bringing in industry to collaborate together, I think Houston's poised to be a real hub in medical innovation in the next decade.
I get to oversee quality metrics in my role on the executive committee of the hospital. I'm really proud to be a member of the medical community here because the outcome measurements, they're excellent here.
I'm honored to be able to be part of the program and the staff to provide the best care for the patient, but more so have their experience to be one of the best.
We're here to take care of people, and we're very proud of that.